this meeting of the CU Board of Public Health to order. Will the clerk please call the roll?
Jennifer Locke,
Present?
Charlene Murray, and Danielle Schneiderway.
Ms. Chenoweth is not here tonight. But we do have a quorum. Moving on, I would entertain a motion to approve the agenda.
So,
I second. Do you have any discussion?
no.
All right, all in favor? Aye? Aye. All right, we have an agenda. We have minutes from our June 24th, 2026 monthly meeting. Is there a motion to approve?
So,
I second. Any discussion of the minutes? Okay. I have none either. All in favor? Aye? Okay, so we have approved the minutes. Public participation. Is there any member of the public wishing to participate? All right, moving on. No public participation. Is there correspondence from the director?
No at this time.
None at this time. I have none either. Do you have anything you wish to share? It's only been 2 weeks. Yeah, oh yeah. All right, no board participation either. All right, we're gonna make this short. All right, moving on. Old business, we have approval of bylaws for CUPHD. Last month, we talked about the need to institute some bylaws. Thanks to a welcome question from our newest board member of where they were. We didn't have them. We've had 2 weeks to look at the County Board of Health bylaws as sort of a template for us, but we haven't come up with the actual things yet. Did you have any comments?
I have one discussion piece, more of a question, and maybe two actually. So I noticed in the very beginning it does list out who the board members are, and I wanted to know if it might be worth our while to include the professional titles as part of that board member as opposed to just the secretary, president, and vice president. And then in Article 5, I think number 2, it says in the absence of a president, vice president, and secretary, treasurer, the board member in attendance with the longest membership tenure shall preside over the meetings. And just in my short time here, I've noticed if one of the 3 of us are not here, we do cancel that meeting. So once I noticed that, it's just kind of going through and tailoring it to specific to our meeting. And I think that's the point of the discussion. But unfortunately, that's the only thing that I've pointed out so far that would need to be updated to reflect kind of how we handle absences.
So, in the absence of Ruth being here, I will point out, I talked with her about that a little bit last time. And I think by statute, our members, the advisory board members are the contributing bodies, basically. Yeah. So it's the township supervisors and then the county board. And so those are, like, we're the only ones who could be voting members. Sure. But we have our professional that we always make our treasurer. So we didn't have to change a lot that's in here. With only 3 of us, I don't even know that we need to make and a vice president as well. I think just, I would be in support kind of just putting into writing the way it has been, where there's, a president, there's a secretary. In the absence of the secretary, or the president being here, the secretary runs it, because then if we're missing 2 of us, we can't have the meeting anyway.
Yeah.
But yeah, just putting into writing what we need with that, I think that's what Ruth will be for when she gets back from her travels. The only other thing that I really noticed is an article. I mean, there's several where there's standing committees. We don't do those. We're more of an advisory board to a very well-run machine, very well-run machine here. So we're kind of just like, yeah, you can spend that money, and yes, it's okay that you already did spend that. Something that in speaking with Ms. Wyman, she brought up was, do we need to meet monthly, or could we make it something that's quarterly or bi-monthly, just instead of being every month?
Yeah.
I mean, this time it's only been 2 weeks because of changes, but usually it's every 4 to 5 weeks, and sometimes there's not really a ton to do other than check requests, but if it would get in the way of getting bills timely paid, maybe we keep it monthly anyway. But it's something we can think about and chew on, I suppose. And then in Article 3, it says that the chair of the county board is who appoints. Back when these bylaws were written for the county board, that was true, but we have an executive now, and so it's a whole thing. We've been working on only the county board chair sits on this role. But if we would make it that it could be someone appointed, it would have to be appointed by the executive in a liaison position. If somebody won't be on that board or in that position for much longer, I'll tell you that I think that it should be the board chair. Anybody who's put their name up for consideration, I've told them, hey, make sure you have your second Wednesday of the month available. So they're all, the potential board chairs are aware of that. As far as anything else, I would really defer to staff and admin to at least give us a good first round of this, and then give us, I guess, a month to really chew it over after the official things are there. I'd like to have these fixed up by the time I'm not in this role anymore, just but it doesn't matter. If somebody else has to do it.
I completely agree. I think a few of our staff already looked at it, but we wanted to make sure that we incorporate some of the structure before we send it to probably like our leadership team to review in depth. I think they will be willing to do that. I'm sure.
And then I'm sure that when Danielle is back in town, she's been in this role the longest, so she'll have the best ideas of what needs to be there and what, because this template from another agency is fitting in some ways, but in other ways it doesn't really help. So, for that, I think we kick this can down the road for another month. All right, we're taking no action on that one. We will, we'll just leave that for further consideration. Moving on, follow-up discussion and approval for increase in environmental health food program fees. Is there a motion to approve the increase in, I second. Dr. Takar, does anybody want to kind of remind us how we got to this point and what the fee structure would look like going forward?
So the original discussion we had was in March, and at that time we talked about the fee increases, and then I was asked to get input from the food service operators, which I did. So the information that we did was take that back to them, and then I basically populated kind of like a summary of that, which most people were in agreement, they were supportive of it, they just asked it to be kind of tiered in. So that's what I did. So you'll have 2 years of fee schedules, which that wouldn't go into effect until May of next year for half of it, and then the following year would be the other half for the total increase. So it would be over a 2-year fiscal period.
And it looks like once we increase those fees, we'll be in line with peer counties. We're not going to be out of line one way or the other.
We're still below
a little
all
bit lower
of
than
them.
the average.
Yes, we're still below average on all of those.
Well, thank you for doing the work on that to bring us modern day and raise the rates a little bit, but checking in and making sure that it's not burdensome on our various.
And I just wanted to add, so to give Danielle probably some time to catch up on this, but I think it's important to say that we didn't have a fee increase for 2 years. So in EH, and we did a comparison study looking at every county with the same population and demographic, and look at their fee schedule for inspections, and some of them were double ours. But we took, I think, the 3 main counties that are comparable to our county, and then take the average of the fee. So that's what is presented to you guys, and when we presented first, I think there was a suggestion to send this to operators, like Sarah said, to get their input. So great feedback. I think based on the survey, was 77% of the people who replied that to do the increase. And one of the main reasons also we wanted to do the increase is that we use that fund to hire more staff. Because before even we get to this, more of the funding were coming from our general funds and fund balance, but I think as we start collecting this fund, it will allow us to potentially hire new staff and retain, because one of the biggest challenge right now in EH is that, you know, we'll hire staff, train them, get the license, and they'll leave. So hopefully this will help us do that and expand EH in a way that can allow or benefit the county in general. But I wanted to say that they do amazing work. Since I got here a year ago, I feel like I haven't heard any foodborne outbreak illness, and I just want to make sure that that could go in. We get a phone complaint, but really, like, they have been amazing, and right now we are short staffed because 2 of the staff that we train and are living. Anyway, we just want to make sure that this work and allow our EH to continue to do the great work that they have been doing for the community. Yes.
I'm sorry to be late. Thank you for doing a survey as requested. That's super helpful, and I expected that folks may want a phased approach. It really is about managing risk and expenses over time for many business owners. As a person who owned a business for 15 years, like having something double overnight is be really hard. Can you tell me how many respondents? You said 77%, but what was the
We
total?
didn't have a big response.
Yeah.
Like, I sent it to over 800
Okay.
operators that
Yeah.
did multiple, and
Yeah.
I had maybe 50 responses total.
Okay, I was wondering, I mean, 50 out of 800 isn't terrible. It's not, you know, it's not great, but it's, oftentimes you'll hear from the folks who have the biggest,
Mhm.
was it by, you sent it by mail or?
Email. I
By
emailed
email to
everyone.
them?
Yeah.
Okay. Yeah, I just wanted to make sure I knew what the 77% was, because if it was 5 or 10, we probably didn't hit the mark, you know what I'm saying? So, I support the proposed, graduated, increase over 2 years.
I guess I just have one question. If, you know, we don't want to find it being 20 years before the next one, but we also don't want to increase it every year. Is there a
Yes.
plan to revisit it in 5 years, 3 years?
Right now,
When it
no.
makes sense?
Right now, no. And really, you know, when I came in, this was emotion because we really see the difference in the work that they're doing and also the fee schedule. Maybe that's an idea to brainstorm and see if we can review this in 5 or 10 years and not linger that long. But right now, there's no plan. We just want to do this incrementally and see how it looks like in the future.
I did get input from some health departments that did a kind of cost of living increase every year, pros and cons. Because then, you know, there was some opposition for the board because it should be just an automatic. But then it didn't have to keep coming back up every year. So I saw both sides of the story from the locals and from boards of health on that.
From a fee perspective, I've seen it where like sometimes things are set it and forget it.
Yes.
And it's easier for this seat, but
Yes.
it's way harder for the business owners.
Yes.
So that's just something to kind of maybe make a calendar reminder for 2-3 years. Hey, it's been a while. Or
Yeah, I almost would consider at least revisiting maybe in about 5 years, maybe we do or maybe approach that cost of living, even if it's like 2% a year, so that you can kind of keep up instead of a 20-year span of time.
I mean, I would encourage, sorry, raise my hand. I would encourage a minimum of every 4 years, like thinking about, you know, think about how to manage that cost increase.
maybe make it in presidential election years or off of, or the midterms, or just
Oh.
something to, just as like a, we haven't done this in a while, but.
Yeah.
Oh, I was going to say under 8 years.
I want to also mention that we take this to the share that with the county board notes to approve it, but just share the idea. And they were overwhelmingly supportive of it. But we wanna make sure that CU voted first and then take it to the county board.
Seeing no further discussion on that, all in favor? Aye? All right, ayes have it. We have voted on it, great. All right, moving on, new business, we are seeking approval of payments to Board of Health appointees. I'd seek an omnibus motion to approve payments to Treasurer Ron Fields for June 2026 services, and then also to Attorney Ruth Wyman for legal services 5/16 to 6/15 of 2026. Is there an omnibus motion? All right, any discussion?
I just,
Yep.
can I talk?
Yeah.
I feel like I'm mentioned.
Yeah, no, you're good.
So I just wanna say that how amazing the group have been, since we have that scheduled meeting.
Yes, very good idea.
Yeah, you know, we have been through a lot of challenges, and I can tell you, she has been very responsive, on top of things. She's in Italy, but we're still communicating and getting things done. I received like an email from her like probably like 20 minutes ago. Just wanna say how amazing she has been for CUPHD.
Great, she is fantastic and highly responsive, whenever I have a question, so, great. Any other discussion? Okay, all in favor? Aye? Okay. Any opposed? Okay, great. Moving on, review of monthly credit card statements. Is there a motion to, place on file? Questions or comments? All right.
I usually would have seconded.
Okay.
I should put them out.
All right, any discussion of the monthly credit card statement? All right, all in favor? Aye? Oh, there we go. Moving on, approval of check requests. Do omnibus for Douglas County for April 2026 ITFC activities, and then also Douglas County for May 2026 ITFC activities. Is there a motion to approve?
So moved. Second.
Okay, any discussion? All in favor? Aye? Okay. Then we have Champaign County GIS Consortium for Principal Data Client Agreement. Is there a motion to approve?
So moved. Second.
Any discussion? Okay, all in favor? Aye? Illinois Public Health Institute for Strategic Planning, Consultant and Facilitation. Is there a motion to approve?
So moved. Second.
Okay, any discussion? All right, all in favor? Aye? Okay. And then finally, for check request, Family First Advocacy NFP for June 2026 invoice. Is there a motion?
So moved. Second.
Any discussion? Okay. All in favor?
Aye.
Before we move on, I do want to point out with the Douglas County things,
Mhm.
their reimbursement form notes reimbursement for financial year 21 on the form.
Yeah.
Like now, like the
They have
dates
that
are
date.
dated 2026, but they might want to
Okay.
have, I mean, it's just in some of the small type, but it says
Okay.
financial year 21.
All right.
Okay. Moving on, we have approval for expense sheet to Winters Moving for May 2026 invoice for moving emergency shelter equipment from the Armory to CUPHD. Is there a motion to approve?
So moved.
Is there a second? There is a second from Ms. Chen?
No, I'm not
Okay.
seconding.
Okay.
I am abstaining from this vote.
Oh, okay.
Because the armory was operated by a friend and me, which was contracted by Cunningham Township. It was a joint venture between Public Health, Cunningham Township, and Friend and me, and so I don't feel comfortable voting on it.
All right, move first, I will second. And noting Ms. Chenoweth's abstention, is there any further discussion? I have none either, I'm just
Should I have
happy
a
we
roll
had.
call?
Okay, and could we have a roll call for this one?
Jennifer Locke,
Yes, I approve.
Charlene Murray,
Yes.
and Danielle, I'm sorry, Shenoweth?
Shenoweth? Yeah.
Shenoweth?
Abstain.
Okay. And the ayes have it, we have approved the expense sheet. Moving on, we have approval of bid to A1 paving for CUPHD parking lot resealing and restripe. Is there a motion to approve?
So
Is there a second?
Second.
Okay. By way of discussion, I'm gonna start.
Yeah.
We're just Mr.
Yeah,
Tinkar,
yeah.
Dr. Tinkar on too. I've sung the praises of our weighing sheet for
Yeah.
these bids, and then
Yes.
this one bit us right in the
I
behind.
know.
So, just the simple math for
Yes.
anybody that might watch this. The highest scoring bid is almost 13,000 higher than the lowest bid.
I read it wrong, I read it as 32, 32, 36. It's 23, 32, 36.
Yeah, so it's almost
Got it.
13,000 higher, but that's still
Yeah.
54.67% higher than the lowest bid,
Yeah.
and also 12.3% higher than the lowest local bid. So I think by policy, I'm gonna have to vote to approve this, but I'm also gonna ask that we, at maybe our next meeting or some later time.
Before you
Yes.
approve, can I
Just-
suggest,
Oh.
okay, oh no, go ahead.
No, please, you're gonna say the same thing I'm saying.
All right.
No, I wanna hear your.
I wanna hear from the board
So
member.
my understanding is that the reason it comes to a board vote is because it is the board's vote, otherwise it's not automatic.
Yeah.
Okay.
So
So we
what
can't say the other
they
one.
do is, the staff will do, and you all have been wonderful, has been make the scoring sheet very simple to see what the proposals are. We are open to staff comments, which there's space for comments, and then, we choose. And so I think we have in the past, just as I think the resident historian, because I've been here longer
Thank you.
than
Everyone?
yes, actually longer than Ron, I think.
Slow down.
Yeah, okay, so I haven't been longer than Mandy, Mandy's got me on seniority, but, we have, since we put this in place, selected lowest bids when there was a significant difference. We looked at cost-benefit analysis of going local, minority, women-owned, disability, veteran-owned, and cost. And I'm sorry, I was reading through this really quickly, and I saw 32, 32, 36. In that case, speaking for myself, I would probably go with the 36 or possibly the 32 over someone with no score. But in the case of it being such a widespread, I think it would be prudent for us to go with the lowest score unless in the staff looking at the bids. If you spoke with the contractors or you had a specific recommendation, I'd want to know that from staff before voting.
Yeah, I just wanna share my thought, and, staff can share their thought as well. So for me, I think, this is the second time, this, specific contractor is getting the bid and hit all our criteria, and we don't have anything in the policy or in the contract saying that, if someone hit all the criteria and they are still higher bid, that we can, that the board can, choose the lowest bid. I don't think, you can correct me if I'm wrong, I don't think we don't have that in writing. So that's my only concern about not going with this, because they hit all the criteria that we provide.
What does the bid sheet provided to them look like? I'm sorry, I don't have it in front of me here, but yeah. In
The bid
terms
sheet
of-
or the ordinance.
Or what, yeah, well, we have our ordinance, but in terms of what's provided to the individual
Because I
contractors,
think that
what they have is, if they receive,
13,000 is a lot.
Yeah.
in-
yeah, I would love
Yeah.
to pick the lowest one or the lowest local. I'm just wanting to make sure that what's provided to them, when they give us a bid, do they see anything that says, the county, and that's obviously a different organization, but we go with lowest reasonable. And so when we tell them lowest reasonable, we don't have all of the,
They're just familiar with our process.
yeah, okay.
Like we got that bid a year ago, and they, again, scored the most, they were really the highest. So in our thing, it's like, okay, we're going with the policy, and we're following the board rules, but like, we don't wanna spend $13,000 more
Yeah.
than.
Yeah.
But in the ordinance, in the policy, it doesn't say the team has followed the board's direction and gone with the lowest bid, and the ultimate decision is up to the board. It doesn't read that, so they're gonna come back and come to me or Jim and say,
Yeah, I don't want them to come to us with a lawsuit and then I have
Yeah,
to
but-
pay to fight that, or.
I mean, I helped, I did a lot of authorship towards this
Okay.
ordinance.
Yeah.
So and I'm sorry, I didn't bring my laptop, I was gonna work from my my phone, cause I looked this over in advance, so I could usually pull up the ordinance. Do we have the language of our policy on this that we can look at, because,
No,
I have it on my phone, but it's.
Yeah.
Okay.
it's
So,
small.
yeah.
another suggestion that I would say is that
I'm
we can,
positive we didn't have a policy that said.
we can wait until the next
this-
board, because
yeah.
because I really feel like 13,000 more.
Oh, no.
It's
Yeah.
a lot.
And just for the record, we have not always gone with the highest score.
Yeah.
I would have to look to see when we made a difference.
Yeah,
But the whole idea is that it gives us some information. I mean, what essentially an ordinance, if the ordinance was written that we have to go with the highest scoring,
Mhm.
then we could be very easily fleeced.
Mhm.
And so I'm sure, and so I know that, I'd have to look at the language of the ordinance, but I believe the staff scores and the board looks at it and approves.
Mhm.
And I don't actually think it would be fiscally responsible for us to have an ordinance that says we must pick the highest scoring, because people can then price fix or fleece. So can we just look at the ordinance language for next time?
Yeah.
And if for some reason
we'll bring it and we'll share
and
with
why don't you go ahead and put it on the ordinance language on the agenda
Yeah.
as a agenda item prior to this vote?
Mhm.
So if there's some change that we need to make that's a clarification, we could do that prior to the vote on this.
Yeah.
And we'll meet as a group
Okay.
as well to discuss all of this.
Okay.
Yeah, we just have some concerns because the same companies continue to bid and overprice because they're scoring highest.
Yeah.
So,
Yeah.
They know they can.
Yeah. And they think they will get it too.
Yeah.
Because,
So, this is just knowing how people with my background make a living. If it's not clear that it is discretionary,
Mhm.
it wouldn't be a frivolous lawsuit for them to file, and hopes of settling so that they get some lost profits or something. It wouldn't be, but we don't want that. We don't want that. So, yeah, if we need to make a change to the ordinance, regardless of how we ultimately would vote on this one next month, I would like to just add some clarifying language to the ordinance.
I'll move to defer or table, I'm not sure which.
I second to move to table this to next month. All in favor of the motion to table? Aye. Okay, that has been continued on to next month with instructions. All right, moving on, we seek approval of renewal agreement to commercial pest management maintenance August 1st, 2026 to July 31st, 2027. Is there a motion? Is there a second?
The second.
Okay, any discussion?
I lost my page. Is
This is
this,
number 6.
is this one that we bid out, or are we looking at a straight renewal?
It's a yearly renewal, from what I can tell.
So it wasn't one where we bid it out? Is this?
Originally, I'm not sure.
Okay. No, I mean, this is again, what does our policy say with regard to renewals? Cause I thought that with renewals, we were looking to follow the same scoring criteria, but again, this teaches me that I should just have the policy with me and then I'll be
And
good.
I really feel like the policy works, and, it's probably challenging for staff to always get to read, code, on the renewal, but I think that the policy is really make the process fair, in my opinion.
Yeah, and I think the issue is when you do renewals, the whole problem is if you used a certain provider and it hasn't necessarily been open, we wanted to go ahead and open the process up. And so, the dollar figure is what kind of triggers it, if it's under a certain dollar or
Yeah.
over a dollar. And I'm looking at the pest control.
It's at $151.25 per visit for 12 months of visits.
Okay.
So I think it would be below any number.
So, so this is just for a single year?
Yeah, usually we do it similarly. And most of the time, I think,
It's underneath.
Mandy can correct me
That's right.
if I'm wrong, anytime that we get to equal if it's above 5,000,
Yeah,
which is.
that's right.
I think this would be below.
Yeah.
Yeah, I was looking to see, it's actually a really good service fee, I wish I had that service fee for a space this size, so.
I would note that whoever manages this will want to update the contact info for them because it says Julie Pride and it lists her email here.
Okay,
So,
update the contact.
yeah, it's just on the renewal contract. Any other discussion?
No.
Okay, all in favor? Aye? Next up, we have approval of bid to Service 51 website migration and support. Is there a motion to approve?
So, second.
Okay. Any discussion?
This is Service 51 we're moving from on-site to a cloud-based server for security purposes.
Mhm.
And Service 51 is our current entity that we work with on this.
Yes.
Okay.
Mhm. And we work with them in a lot of other.
Yeah, they did the work.
But if you want any clarification, the IT guy is here. If you want to add anything to that, to the migration of the processes, he can provide more explanations.
We had a website issue, correct, recently?
It actually just, I'm pretty sure, fixed all of it about a half hour ago.
Okay.
Yeah.
And yes, we did have a website issue.
Sure, I understand, yes.
We did have a website issue, but we also have a security system from the state security system were able to block whatever attempt was made on the website and block everything. So what we did is that we turned down our server because we have everything. We're very grateful about the IT support that we had, and if you notice, like anytime that there is an event, emergency situation, we're able to like do things on our website really fast for communication. That is because we have our IT team inside and we have our server inside.
Yeah.
Those are the plus, you know.
Yeah.
But there is a lot of other things, so maintenance and all other issues. So for this specific cases, we are able to turn down our server internally, and then since we are working with Surface 51, they have a copy of our website in case anything happens, so they can we can use that copy of our website. So right now we're using that copy of our website, which is very static and informational, but it doesn't allow people to share information with us, because you can go, if your website is fully operational, you can go on our website and add information, say, hey, I want to contact this person, and email will be generated to that person. So right now we can't do any of that. So none of
So
our
it's like a static version of the site is what we have up at this point?
Yeah, he said that Jason just briefly said that he fixed it. I haven't checked, so I can't. But we will. The goal is to make sure that we redirect our link to our server so that all of those forms can work. But as of before we came here, I checked. We were not able to do that yet. But I don't know if you have any other specific questions. But the goal for this specific approval is to have all of our, specifically our website on the cloud. So one of the benefit of that, if someone leaves an account on our website, we can shut down our server and everything will be on the cloud.
Yeah.
So it's expensive, but best practices as we go through this,
And so it's in the cloud, I mean, who is,
the service provider for that.
who's the service provider?
Surface 51.
So Service 51 will be the service provider, and they'll also be the cybersecurity.
No, they,
Who does cybersecurity in their cloud?
We haven't selected the actual cloud vendor yet.
Okay.
What we are, Surface 51 works with a number of different vendors. They do have a recommendation for us. The cost is going to be incredibly low for the cloud hosting. We'll probably have some costs associated with total bandwidth. So it depends on how many times people go to our website, how many web crawlers are out there. Just basically just traffic that's generated. What Surface 51 is going to do for us is help us make that transition to get the website out of our building and make sure that all of the custom forms and some of the other custom pages that we use for new employees, for performance management tracking. There are a number of other scripted pages that are part of that. And so what they're going to do, we miss Steve a lot, by the way. So I don't know if you guys remember Steve Bronkow, our old web developer, but He made a lot of things possible that now we need to reach out for help for. So Surface 51's been a great partner for that, helping us, kind of fill in some gaps. The primary reasons, like as Mamadi was talking about, for getting the website out of here, security is certainly one of them. It can help keep the website safer. It can help keep our network safer. Downtime also. These cloud service providers are they provide what is commonly referred to as 5 nines uptime, 99.999% up. That's really the direction that a lot of government agencies, municipalities, school districts. Unit 4 has been in the cloud for, 7 or 8 years at least. And that's just kind of the direction that things are going.
Okay, it's a question, and I'm sorry, because I know I've been out for a few meetings, so. What is a summary of what happened briefly? And what is, I know there's this and the next item on the agenda which are linked. What is the plan to prevent it moving forward? And if we've covered these bases, you can be brief. I don't.
I can jump on that. So when the event occurred, we engaged, before I share anything first, I wanted to say that we are working with a law firm to help us with issues, and one of the things that they told us is to not share anything until we have a complete report of the forensic report. But like you said, a brief summary is when the incident occurred on May 7, early in the morning, when the incident occurred, we shut down everything, just as a precaution. We shut down everything, and we engage with our insurance providers. So they allow us to hire 2 entities, a consulting law firm and an IT company. So the IT company, these folks have been doing this is their job. So they have been doing this for.
I'm sure public health departments across the country
Yes,
are targeted, so
yes.
I understand.
And they have worked specifically helping other agency with this threat actor for many years, or more than 70 agencies that they told us. But the main things that they do is that they secure our network, put a fence around our network with their security system, and kick bad actor out.
So the whole network, every computer of the network, not just the website, but the
Yeah.
whole. Okay.
So we were able to be back up in about a week.
Okay.
And then be fully operational. But we took different processes to change our password and reach out to staff who work remotely, do a lot of other stuff to make sure that we are fully operational. And they sent us a letter to share with our partners and collaborators, just to make sure that they know that our system are secure and they can interact with us. So that is the first things that they do. The second part is what we currently are in the process of doing, but still this is an ongoing process. We can't tell. We don't know. We do not know still now what caused this unless we get the forensic report. So we still haven't got that. But the second part is a legal component where they are by law we are required to notify different agencies about what has happened. As part of our incident response plan, we inform federal agency, the FBI, local police, Champaign police, and I think we are in direct communication with the FBI about what happened, and don't want to get into the detail, but the response that we did were good response. And right now we are waiting to get the full report for the forensic analysis, but before we get to that, it's still an ongoing process about notifying different agency, and then from there, whatever the forensic analysis said we take it from there in terms of data mining about what our situation
What-
happened.
So the forensic analysis, I hear, and thank you for the summary, I hear that it was a week of downtime for certain processes.
Mhm.
Are there other impacts that are known at this time?
No.
Like the loss of personal information,
No.
HIPAA violations,
No.
confidentiality breaches? Was there any loss of dollars?
In my knowledge, we haven't had any of those yet,
Okay.
because we have to wait to get the report, and the
Okay.
report will tell us, all right, this is what happened. So since we don't have the report, anything that I would say will be speculations.
Okay.
So, we'll
But
wait
we're
until.
not aware of losses at this time?
Yeah, we're not aware of any losses. And other things that we can also see that none of the data have been posted in the dark web as we talk, as
Okay.
today.
Okay.
Which we're told that
There
that's a
are
good
dark
thing,
web
but
scans,
yeah.
yes.
So, but still, even though we do not have any data that were posted in the dark web, we are still taking everything that's required by law.
But yeah,
to
sometimes
do-
there's a delay between capturing data and
Yeah.
using it, and
Yeah.
that's a strategic advantage.
Yeah, so we just wanna make sure that we cross all of our step and follow all the steps required by law to make sure that everything is good. So that's the process that we're doing now.
Okay. Bummer.
I know. But any other questions on this?
Alright.
Okay.
Seeing no further discussion, all in favor of approval to bid to Circus 51 website migration and support? Aye. Okay, that passes. Next up, approval of 9200/2001 cybersecurity policy for CUPHD. Is there a motion to approve?
Second.
Okay. We've touched on it, but you just want to give us the broad strokes?
Yes, you know, as part of the incident, we decided as a team that we won't pay anybody. I mean, there were several attempts, but we decided as an agency that, also in consultation of a lawyer, that we won't move forward with paying anything. So there were a lot of threats. I don't wanna get into details, but we stood our ground and weather. So we're still doing that. So as part of that process, we came to realize that we did not have, you know, it was so heavy emotionally that we were like, we shouldn't even talk about paying someone who did this, because these are people who are not very honest people. I mean, so we decided that it would be good to put the policy in place. So, because this event, you can't prevent it. We have to be very upfront and clear about this, because it was not only us, it was the university and other organizations. So, so we cannot prevent it. What we can do is to strengthen our system and have backup plans if it happens, so that we can get back rapidly and be fully operational. So we decided that to bring up a policy. So also in the back end, having a policy, you know, if a threat actor could go online and see that, oh, you have a policy, they won't waste their time in trying to attend. So we decided to put that policy in and said that we as an agency, we want to be fiscally responsible and not do anything along those lines. So our HR director, Patricia Robinson, she dropped this based on the nature template, which is the national, if my mind is still functional, it's the National Association of City and County Health Officials. So they have a draft of template, because this has been a recurring issue for many municipality and health department lately.
Yes.
So we draft that and we want to present that to the board. So once it's approved, it will be a safeguard, an extra layer of protection for us.
I just wanna add, for anybody that wasn't here last month, that we, it was at our direction too, it wasn't,
Yeah.
we very clearly said, we want to make it clear to any bad actors as well, so thank you for getting that together in the 2 weeks since we met last. Is there any further discussion of the cybersecurity policy? Okay, all in favor? Aye. Okay, moving on. Approval of quote from Suits Lawn Care for landscaping services. Is there a motion?
So, second.
Okay, any discussion?
Yeah, quick question. Is there a reason that, this is a company out of Gifford, is there any reason why we didn't do
It'd
the
be-
scoring sheet?
alright,
Is it
this is-
because
yeah.
because it's 70, I'm trying to remember, if it was
Yeah.
5,000,
No,
this
it's
is
five,
6,700?
yeah, it's 5,000, but, this
It's-
was purely my fault.
Okay.
Because, we had a bid, and the bid was to remove trees that was leaning to one of the refugees, and then also plant a few of the flowers, yearly flowers that should come back. So, but in the process, I went and checked, those things were completed, and we didn't need approval because it was like 2,500, we didn't need
Yeah.
approval. So when I went outside and checked, I realized that, they were, like there was no, gravel in some of
Oh,
the.
you added on to the,
Yeah, I
so
had-
you had added to the scope
Yeah,
after?
yeah, I was like, okay, let's add more
Got it.
in this, and not realizing that we need, probably it would bump up the price.
Yep.
And then, but I said, hey, let's add more gravel in this side, let's put some flour in here, and I was just like going on and
Yeah.
on and on. And then he came back and said, all right, this is so cool, man, we should have done this, but that is purely my
Okay.
fault.
So it wasn't like a performance review.
Because honestly with the.
I would take full
No,
responsibility
It's,
if.
it's fine, I understand scope changes, and actually the policy, if we look at it, we should address scope changes, because they happen. Especially for larger projects,
Mhm.
you'll have a situation where you open a wall up and it's got a totally different set of things, and so what
Mhm.
does that mean? So I think it would be useful to include that. I do just wanna say that when it comes to landscaping services, it's a really great way of building, support for local minority and women-owned businesses,
Yeah.
who are getting their foot in the ground, so
Yeah.
I name that, and I have a number of people I would say, send the bid out to.
Yeah, yeah, we'll certainly,
Okay.
we'll
But
certainly will
that makes
do it.
sense.
We'll plan to do it next time if we decide that the bid is above 5,000. I also wanna say that like all of these things, like you can go walk around the building, it looks nice. There is a table, what is it, a table, yeah, there is a table on the refugee center side of the building. Because it's hot now, sometimes, like
Yes.
it's good to come out. So we bought like 4 tables and,
Nice.
I'll just say, all right, add more table and then it will just come back more money, and I really didn't think about it, I just, and then we also added another table on our MCH side of the building, so there was one table, so we added more tables.
We call that scope creep.
Yeah, I hope it helped, again, I'm learning that, we have to bring things, to the board and, have the, which I usually do, but for this one, I was just like, all right, let's add this.
Yeah. They're already
So-
here working at
I
the time.
know,
Yeah.
I know,
Yeah.
but, next time I'll definitely put that on my radar.
Yeah, and also look at scope changes, which are necessarily gonna come up sometimes, and if you already have somebody on site who you've approved, I think it's reasonable to say certain changes up to a certain percentage or amount, so just consider what might be helpful.
Okay.
So it's not overly burdensome policy.
Okay.
Any further discussion? Okay. All in favor of the approval of quote from Suits Lawn Care? Aye. Okay. Has been approved. Next up, we have annual review for the Public Health Administrator, Dr. Mamadou Tankara. Is this the kind of thing we usually do in closed
I
session?
believe it's, yeah, didn't see anything in the packet, so I assumed this may be a closed session conversation, but it's not listed as such.
I think Amy just wanted to give you a heads up that it's coming.
Okay.
Oh, okay.
Yeah.
Even better.
Hello, I
Hi.
thought I would stand because I couldn't see you, but
Yeah.
I don't want to assume that the board wants to do it the way we've always done it, but I would give you a brief description of what we've done in the past. send out a template to each board member individually. You score it, and then I combine them together, and then you meet in a closed session with Mr. Mamadou, Mr. Mamadou. And then, I think then you open the session, and then you do it openly or whatever.
Great.
But I will provide the template for you via email, and then you can return it to me, and I'll put it all together.
My only recommendation, and I'm speaking as the person who oftentimes, I need a deadline, so if you could just give us a deadline, you're very kind in saying, here it is, and you leave it open-ended,
I
and
do.
it makes it hard
Okay.
for me to prioritize it, because everything else has a deadline, so I would just ask you to be
Okay.
strict with me.
I think we should have it done before September 1st.
Okay.
So I will put a deadline in there so that you can do it in August at the meeting. I can get that back, because it's not, there's 10 competencies included. It's exactly what we do for the staff here, but we have a computerized version here, but I'm just gonna send you the template of that and you fill it out. Okay?
That's great.
I just wanna add that, for our staff, internal staff, we plan to complete everything by, July 10th?
July 10th,
Yeah,
yep.
for the evaluations.
Yeah, for the
Oh,
evaluation
okay.
for all of our staff, so.
Okay, great. All right, we have that process in place. I don't see that we have any pending grant contracts for the administrator to sign. Our next monthly meeting is August 12th at 5 p.m. and I call this meeting adjourned at 5:52.
Or I think there's a contract for $82,809.
Yes, there is a template.
I could just make a motion.
Yeah,
That's
that's
helpful.
good.
I move approval of the contract between CUPHD and IDPH, Public Health Emergency Preparedness Fiscal Year 27 in the amount of $82,809 for the contract period of July 1, 2026 to June 30th, 2027.
Thank you for catching
Sure.
that. I second. Any discussion? All right, all in favor? Aye.
Oh, that's probably.
All right, now, monthly meeting is August 12th and call it adjourned at 5:53.
Thank you.
Sorry.